Hello everyone, I'm Laura, and today we're going to tackle a delicate but essential topic: masturbation and the potentially harmful effects of pornography. This is not your average video. It may be disturbing, thought-provoking, or even debate-inducing, but it has been highly requested by this channel's subscribers. Therefore, I have chosen to discuss it with seriousness and respect. The central question we're going to explore is this: is it a neutral, beneficial practice, or, on the contrary, a risk factor for mental, physical, or relational health? In other words, is it a wellness approach, or, sometimes, a sign of imbalance, or even a behavioral disorder? I invite you to watch this video to the end to form a complete opinion, and above all, don't hesitate to share your point of view in the comments, always in a spirit of respect and listening. So, why this video? Because it's time to talk about this topic without judgment or taboo, but with clear foundations: medical, scientific, and factual. My goal is not to offer a personal opinion, much less a religious one. This isn't about morality, but about health. Because yes, masturbation, especially when compulsive or associated with excessive consumption of pornography, can lead to serious medical, social, and psychological consequences, and that deserves to be discussed. According to several international studies, nearly 90% of men have been exposed to pornographic content at some point in their lives. And since the pandemic, this consumption has increased sharply, particularly due to isolation, boredom, or stress. This isn't a marginal phenomenon, it's a social fact. So much so that around 20% of Google searches are now related to masturbation or pornography. So, should we be worried? Not necessarily. But it's important to differentiate between occasional use and behavior that has become problematic. Some men explain that they can no longer do without it, that they feel trapped in a form of addiction. This is where the line between healthy sexuality and compulsive sexuality becomes blurred. Subscribe now, click the like button, and tell us in the comments which city you are watching this video from. One of the most common questions patients ask is, how many times is too many? The truth is, there's no universal number. It's not the frequency that defines the problem, but the impact it has on daily life. When masturbation becomes a systematic escape, replaces real intimacy, disrupts relationships, causes social withdrawal, or affects work performance, then yes, we can talk about addiction. Another warning sign: the inability to control the urge. If a man feels an overwhelming and irrepressible urge to masturbate, especially in connection with pornographic content, despite the negative consequences it engenders, this is a true behavioral addiction. And this addiction can have multiple repercussions. Subscribe now, click the like button, and tell us in the comments which city you are watching this video from. For example, excessive masturbation with pornography can desensitize the brain's pleasure receptors, create a form of tolerance, and therefore push people to seek out ever more extreme stimuli. The brain ends up getting used to a form of artificial sexuality, which has nothing to do with the reality of a human relationship. As a result, some patients are no longer able to reach orgasm with their partner, while others suffer from premature or delayed ejaculation. Their bodies no longer react normally because they have been reconditioned by unrealistic digital images. And this is where the problem becomes serious. It's no longer just a private pleasure, but a disorder that affects health, emotions, actual sexuality, and sometimes even self-esteem. We'll continue to explore these dimensions in the rest of the video. But then, what are the concrete problematic practices and the damage that they can cause in a man's life? The first point to note is the common association between masturbation and pornography consumption. Individually, each of these practices can be harmless when used in moderation. But when combined repeatedly and compulsively, the effects can become concerning. Pornography, in its modern form, is designed to capture attention, shock, excite, and engage the viewer. It is often shot in an exaggerated manner, with extreme scenarios, hypersexualized bodies, and unrealistic performances. However, the human brain, especially the young male brain, is highly sensitive to these visual stimuli. With repeated exposure, the brain eventually develops a habit. What excited before becomes insufficient. It is then necessary to seek out increasingly intense, more specific, or more extreme content to feel the same excitement. This tolerance phenomenon leads to artificial sexual conditioning. The body and brain react only to digital images, not real stimuli. As a result, many men report a loss of pleasure with their partner, difficulty maintaining an erection in real-life settings, or even an inability to reach orgasm during intercourse. This is called progressive sexual anesthesia. In some cases, it can also cause the opposite effect, hypersensitivity, causing premature ejaculation from the first minutes, because the body has been overstimulated by fast, intense videos without real interaction. But the effects aren't just physical. They're also emotional and psychological. Many patients report feelings of shame, guilt, and even self-loathing immediately after the act. They promise themselves they'll stop, but start again. This spiral fuels a vicious cycle of frustration, loss of self-esteem, and sometimes even depressive symptoms. It becomes a ritual of immediate relief to escape boredom, loneliness, anxiety, but one that weakens in the long run. When it starts to interfere with daily life, the consequences are real decreased motivation, disinterest in social activities, isolation, conflicts with partners, decreased productivity at work, sleep disturbance, or even total dependence on screens. The patient cuts himself off from the real world. So what should you do? When should you ask for help? As soon as a man realizes that this habit is dominating him more than he can control it, that it is affecting his quality of life, his sexuality, his morale, or his mental health, he should not hesitate to consult a health professional. The ideal is to start with a urologist, then, depending on the case, to integrate multidisciplinary support sexologist, psychologist, cognitive behavioral therapist. Fortunately, there are effective solutions. Rehabilitation techniques, desensitization exercises, strategies to regain impulse control, and above all, in-depth work to rebuild a healthy, real, and human-connected sexuality. More and more men are reporting that they have escaped this spiral and regained their vitality, confidence, and balance. Subscribe now, click the like button, and tell us in the comments which city you are watching this video from. And if you're looking for a natural alternative to reactivate your intimate energy, know that there are also simple methods, without medication or side effects. Certain practices, derived from nutrition, sport, or conscious breathing, can strengthen sexual control, mental concentration, and even improve sexual potency. I'll tell you more about this in a future video. In the meantime, if you recognize yourself in this situation or if you know someone who could benefit from it, don't hesitate to share this video, subscribe to the channel, and turn on notifications so you don't miss anything. Thank you for listening carefully, and see you soon for the rest.